Come in. Doctor, your 3 p.m. appointment is here. Okay, just give me her file and please send her in. Good afternoon, Miss Layla. Please have a seat.
Thank you, Dr. Zainab.
Okay, how old are you, Miss Layla?
I'm 35 years old.
Are you married?
Yes.
Do you have children?
Yes.
Okay, how many children do you have and how old is the youngest one?
I have 3 children, and the youngest one is 1 year old.
What do you do for a living?
I'm an accountant. I work in a bank.
Do you have any medical history?
No.
Are you allergic to certain medications?
No.
Do you have any problem with your monthly menstrual period?
No.
Okay. Now tell me about your problem.
Well, it started 1 month ago when I was working on my computer in the bank.
Mm-hmm.
Suddenly, I felt tingling and numbness in my right hand, especially those 4 fingers, except the little one.
Okay.
I tried to move my hand and fingers without any use. So I ignored that feeling and continued to work. Then, after 1 week, the tingling and numbness worsened, and I started to feel burning pain. I took painkillers to ease it, and I tried to rest. It helped at the beginning, but it got worse and worse that I even couldn't do a simple task like writing and typing.
Mm-hmm.
I thought it's better to take a break from my work, so I took a leave. Last week, I had severe pain during the night that I couldn't even have a good night's sleep. So I had enough and decided to seek medical attention.
Can you give me your right hand? I want to palpate it.
Sure.
Okay, I'm gonna press on this point for 30 seconds and then afterwards I'm gonna release it and then I want you to tell me what do you feel exactly.
Okay.
Now tell me, how do you feel?
My symptoms got worsened.
Okay, I'm gonna ask you to do one more thing and then I'm gonna tell you what's wrong with you. Okay, now bring your hands next to each other. Okay, keep them this way. Okay, I'm gonna count for 1 minute and then I'm gonna ask you to release. And how do you feel?
Well, now I feel pain in my wrist and the 4 fingers that I told you about.
Now I'm gonna examine the neck, upper back, upper limb, especially the axilla. Do you feel anything?
Nothing. Absolutely nothing.
Listen, Layla, your subjective history and your physical examination, they all lead to one conclusion. You have carpal tunnel syndrome. Carpal tunnel syndrome is a common condition, especially among women and the people who use their hands a lot. And carpal tunnel is a narrow passageway in the wrist, about an inch wide. The floor and the sides of the tunnel are formed by the carpal bones, whereas the roof is formed by the transverse carpal ligament. 10 structures passes through this tunnel, which is 9 tendons of the flexor muscles and the median nerve. And the symptoms you're experiencing, the tingling, numbness, burning pain, muscle weakness, inability to do daily tasks, is because of the compressed median nerve. And this compression to the median nerve occurs when there is swelling, inflammation inside the wrist, sometimes fractures, or even bad positioning, like when you are typing, you overextend your hands, or when you are sleeping, you're sleeping with overflex or overextend hands. So before I write down your treatment, I'm gonna write you a request for ultrasound for further investigations and some blood tests, especially the rheumatoid factor, because I want to see if you are like having those things. And I have a question. Do you breastfeed? Yes. Good. Because I'm gonna write to you non-steroidal anti-inflammatory drugs, which is Advil. It's very safe for a lactating woman. And breastfeeding help eases the symptoms quickly. So it's very healthy for you to breastfeed your little baby. But also, I was going to give you corticosteroid injections, but since you're breastfeeding, I think you need to learn how to handle your baby in the right position and keep your wrist in the right position. So I'm gonna refer refer you to physical therapy so they can teach you the ergonomics, do to your wrist some manual techniques, some advices, teaching. It's gonna be very beneficial. I hope you get well soon, but in case you didn't get improvement and we have tried everything, even the injections, then we have to do surgery. The surgery, it's easy. It's from 5 to 10 minute surgery. It's endoscopic, and they only cut the transverse carpal ligament to release the compression on the median nerve. So that's it for today. Here's your papers, and I hope to see you soon.